So we move on to session 2, and that's about presidential address. And for that, I invite Dr. Arun Marwale, who is the president, West Zone Indian Psychiatry Society, Aurangabad. We all know him. He's DM, DNB Endo, and he's a professor and head of psychiatry, MGM Medical College and Hospital, Aurangabad. He's a vice president, come president elect, uh, IPS West Zone. He's a member of Board of Studies, Medicine and Allied Subjects, MGM IHS University. He is an honorable treasurer, Indian Psychiatric Society, Social Security Scheme Central. He is an honorary treasurer, Indian Psychiatric Society West Zone. He's an organizing chairman of PGCME. He's an organizing chairman of first NCYB 18 Aurangabad. He's been organizing secretary for many conferences and CMEs in the West Zone. And with this, I mean, there is a lot to say about him, but uh, with this short introduction, I would ask him to take the dais.
Thank you. Good morning, everybody. Just a correction. I'm a psychiatrist, not endocrinologist. Anyway, at the outset, I thank Madam Vaishali and her organizing team, so also all the co-sponsors, as well as Endocrine Society of India, particularly Dr. Vaishalideshmukh, for giving this opportunity to chair as well as moderate this session. This session, the topic to be discussed is mind health for body health, reorienting physicians. So mind and body you cannot separate. They have a reciprocal relationship as far as the health or disease is concerned. Mind affects body, body affects mind. And the speaker is none other than our president. Definitely he is a very excellent speaker. To share something about him, he comes from basically tribal area, and after completing his graduation, he joined CIP Ranchi for the postgraduate studies. So after MD, for a short while, he joined Vellore, CMC Vellore, where he worked for a very short duration, after which he felt that he should join the medical education. So he joined Vizag as assistant professor in medical college hospital there. So after raising to professorship, he later became the superintendent of that college and also the vice principal of that college, and then he retired. Meanwhile, he was raised in 20. He became the honorary general secretary of Indian Psychiatric Society, and later this year, the last year he was vice president, and this year, that is 21-22, he is our national president. So I hand over this mic to Dr. Yanin Raju, who happens to be our national president, and he will talk about mind health for body health, reorienting the physicians. Thank you.
Let me thank the organizers of Synapse. As I said, especially Dr. Vaishalideshmukh and from the Society for Prevention, Healthcare, Education and Research, and my own Dr. Sanjay Fatke and Dr. Arun Marwale representing us there physically. As I said in the outset, it is really unfortunate that I'm not able to attend a very, very important session. And in fact, I have been traveling for the last 3-4 days, and that is the reason why that I couldn't make it. But it is my luck that I could get connected to you virtually. And also had the fortune of listening to a couple of sessions before this. And it is really uh, need of the that mind-body practice is important, as it is being re-emphasized by every one of us that mind is not different from body. It is part and parcel of it, and in fact, functioning of the body itself is perhaps is the mind. Uh, just I had the occasion of listening to a beautiful talk by Dr. Karthik Balachandran about distress in diabetes and other disorders. And again, before going on, let me say that, as I said, I have been traveling and I don't have slides. So that could be an advantage for the listeners also, that the talk may not last very long. So you would be relieved earlier than what otherwise, if I had a few slides to show. But the disadvantage would be the pleasure of listening to, and the added advantage of uh, adding some information would be missing. But again, I apologize for not having the slides in supporting my talk. But as I said, participating itself is a great pleasure. So, coming back to the distress and other illnesses, for any illness, the most important thing would be distress. If the humans have no distress, most probably there would not have been any medicine. The very important function, the important responsibility of all physicians is relieving from humans from distress, and it is the distress that brings us to the doctor. And any physician, doesn't matter to which branch one belongs to, relieving distress is the most important aspect. And happy that that is being discussed today in a meeting literally dominated by the endocrinologists. I think the majority of today's participants are endocrinologists. Uh, but we know that.
Once again, I'm sorry. I'm really apologize for the inconvenience, as I have been traveling. Uh, there is some disturbances in my network, and I'm not able to connect to you. In between, there was a disruption. Uh, I'm really sorry for that. As I said, it is the distress that really brings us to the doctor, and it is relief of distress that is the main target for all of us. So I'm happy that today we are meeting in discussion to relieve this distress. So when I see the list of talks for entire day, I think I'm really happy that many are being uh, in addressing this. Uh, Coming back to the area of mind, I think understanding of mind, and I'm the happy that I can see Dr. B. N. Gangadhar in virtually, and I'm sure he would be talking the real aspects of mind and its application in day-to-day medical practice. The the importance of understanding mind and for the physician is something which has been there from time immemorial. Even if you take the Indian system of medicine, mind has been on top of the priorities in dealing with disease and its relief. But in modern science, where is this? Where is this mind? I think that is a question which perhaps is very difficult to answer. But more and more we understand, we all know that it is a part and function and parcel and functioning of the brain. So each aspect of the body has a control in the brain that indirectly means in the mind. So each cell, any cell which functions, any cell which acts, the main functioning of any body or any organ, any cell of the body is determined, is controlled by a one part or some part of the brain. So this brain functions through mind. That is what current understanding we have. Mind, by and large, should be the physiology of brain. If brain is the anatomy, mind should be the physiology of brain. So the physiology of brain determines, we all know, we have from time immemorial, from our MBBS time, we have been taught about the hypothalamic pituitary axis. We know where the entire axis controls the stress. It controls the relief of the stress. So the emotions of the disease, that that is very important for most of us. Unfortunately, mental health has not been given the priority importance either by the scientists or by the general public. Reason being that the confusion it created, the confusion it had, the lack of mechanisms, the lack of scientific understandings, that all contributed to the awareness and stigma of mind and its problems. But if you really understand, unless the mental health is important, nobody takes care of the physical health. We know that in recent days, the recent problem which we had, the pandemic, the biggest casualty has been lack of awareness. People lost lives because either their judgment was poor or their understanding was poor. Had their mental health been imperfect, that means, what I mean by mental health is that they understand the disease better. The awareness of the consequences of either taking a right decision in the right time or neglecting when the importance, when the prioritization was the need. I think that would lead to, that led to the problems. They arrived in the hospitals at a very late time. They arrived when nothing could be done. Or some people arrived, occupied the hospitals when there was no need for them to be there. So either of the actions, either both of the actions created the problem for the medical fraternity to help the people as much as they could have easily done. And indirectly, the medical profession too was blamed for doing more sometimes and doing less sometimes. Suppose the question was that if you did more when it was, we admit a patient when it was not required, they would blame the individual. If you can't admit the patient when it was really needed, again they blame the physician. So this is the problem of mental health, not having proper judgmental capacity of the individuals when it was required. Which part of the body determines when I should take care of my body? Obviously, it is the mind. It is our higher mental functions. It's our attention. It's our concentration. It's our memory. It's our orientation. It's our judgment. It's our intelligence. These are the core features of any of the individual's brain or mind. More better you have these qualities, higher you are successful. Higher you are successful in every walk of life. Why some people are successful, why some people are not successful? For simple reason that their mental health is not in the right right concentrations. The stage of mental health determines all our ills. If we are good, if you are balanced, if we have the judgment, we can keep our mind in right spirits. Our judgment in every walk of life would be proper. Unfortunately, as I said, the importance that deserves is not there. And I'm really today happy that Synapse has taken the job. I congratulate all the people who are involved in this, and I only hope that this will continue to work. I only hope and also wish one day I will be physically present to interact with you all. And what best the Indian Psychiatric Society can do from our angle, I think we should be able to do that. Uh, the negligence on mental health is something like, as I think the chairman of Alibaba said, it's like putting bananas and money in front of a monkey. Though monkey does not know that it can buy tons and tons of bananas if it takes the 10,000 rupees or 10 lakhs of rupees, but it takes the 10 bananas only. It would not touch the 10 lakh of rupees put in front of it. Same is the case with a human being. When mental health and physical health are prioritized, unfortunately, we prioritize physical health. It is not that physical health is not important, but If you prioritize mental health, you would know what to do with the physical health, when to contribute, when to meet a doctor, when not to meet a doctor, when not to, again, spend money on that. Again, the blame goes to the medical professionals that we are overdoing it sometimes, we are underdoing it sometimes. The reason for that is the judgment of the customer or the needed person. I think the end user, the public, which is creating problem for the physicians. If their awareness is good, if the measures to take, what to be done at what time, the time management, the timely decisions, that would make the job of the physician that much easier. Unfortunately, that is not being done. I only hope that a day would come when such awareness is being created to the people, to the public. I think what better system is there that we all come together, Indian Psychiatric Society and other societies, psychiatrists and other physicians come together in creating that environment, in creating that atmosphere where people approach the doctor when absolutely required in right time. That makes our job that much easier. Most of the complications come because they don't attend to their health as importantly as they should. We all know that how much hypertension is being neglected. They come after everything. I think complications of hypertension occur. We know how much of diabetes is being neglected. Majority, I think, people say that compliance of mental health is low, but unfortunately, even people who take anti-diabetics, I think it is also very high. They don't take care of addressing the problems at the early age. Had all measures are properly taken care of, something like, as I think the previous speakers were talking about, the obesity, the BMIs, the weights, the height, the food, the health hygiene, the control of diseases like diabetes, hypertension, thyroid, or many more diseases. If had they been properly taken care of, most of the complications can easily be avoided. And if complications are avoided, critical situations where the physicians are put in, the midnight emergencies most of the physicians get because people don't take care of the things seriously in right time. And we know that recent uh, upsurge in physical assault on physicians. Unfortunate again, that is where the mental health is very important. Of mental health of the public is more important. They would have been in a position to judge where the role of physician comes. They understand. Like really, it is unfortunate that recently we had suicide of a gynecologist, and she happens to be the wife of a psychiatrist. Simple reason that the people didn't understand what she was doing. Similar situation should not come. So only answer for not getting such things repeated. We demand something, an action against them one day, we demand something else. But that is not the permanent answer. The permanent answer lies in creating an atmosphere where people understand what they are doing. And they should understand the consequences of actions, what they are doing. Unfortunately, that is missing. Hopefully, conclaves like this, congresses like this, conferences like this create such an atmosphere where that can be created. Another aspect where there is a lot of confusion among physicians, among psychiatrists and psychologists. Also, I think a question has come from the audience too. I don't know who asked that question. What would they do? Again, this is one where I think the onus is on us, the psychiatrists and psychologists, to answer how best we can help them. As I said, everything lies in, if lot of things are in their brain and mind, I think there should be a way to do that. More we understand brain and mind, more you know. I think again I recall the research work done by Dr. B.N. Gangadhar, extensively done by him, where how much yoga has influenced the functioning of the brain, the so-called how neuroplasticity has been influenced. We all know, I think the earlier belief that the brain doesn't change, but recent advances have come. the recent advances of changes in the brain, even through some psychological methods. That is through most probably through neuroplasticity. The so how best I think systems like yoga, meditation, and other non-physical methods have changed the functioning of the brain. Even I think physically too, we have changed. How well, I think, I don't know how many physicians are aware of relief from the suicidal thought through physical methods. Two methods which instantaneously relieve an individual to kill himself. One is the age-old electroconvulsive therapy, and other is the recent advances made by injections of ketamine. I'm sure all of you know ketamine is an injection used as an anesthetic, but nowadays more and more frequently we are using ketamine as an emergency method. Immediately within few hours, I have to relieve an individual from thoughts of suicide. What I do is give point low dose of ketamine, something like 0.5 milligram per kg body weight. Either, I think there are a lot of research and a lot of routes of administration. Traditionally, we have been doing it as an infusion over 40 minutes or 45 minutes, but now nasal sprays have come. Now even IM is being tried. Even I think recent study I have seen, mix ketamine with food and make them drink. So such a revolutionary evolutions are coming up. That means we can control thoughts through some physical methods. We know that, as I said, how can knock off suicidal thoughts by giving an injection? This is something absolutely, I think this is a result of the research of the both basic scientists and the physicians and psychiatrists. So a day should come where we club both, where I think, let us not underestimate the influence of psychological methods, but at the same time, let us not shun away from the influence of physical methods on mind. This is a classical example which I am giving, is that ketamine being given a spray just because somebody, like, imagine a situation, I think I'm sure a situation has not come, but imagine a situation that you have a spray in a house. Whenever your family member feels that she feels like dying, she makes an attempt, you just the spray in the nose, and within half an hour everything is gone. Something like the advertisement we used to have, just gaib. So this is what we are advancing with. I'm sure, as I said, I repeat, the effects of psychological methods on judgments, effects on psychological methods on awareness, efforts of psychological methods on day-to-day practice will only grow and will create a situation. Once again, I repeat, I think most of the endocrinological disorders, we have health style management changes in the health style, but how many of them participate? Very few. I think every TV, every physicians, everyone advises like a scheduled food, a scheduled activities, physical activities, and also very balanced diet. But how many people really follow them? Hardly any. Even including our own brother, we ourselves, we only preach, but we don't follow. Reason being that we don't understand the important. Why we understand means our wiring, our neuronal substrate don't force us to do that. Why we don't do that? Because that is not associated with pleasure. Why it is not associated with pleasure? We couldn't combine that activity with a pleasurable activity. Again, psychology comes here. Unless psychologically an activity is clubbed with a pleasure activity, it will not be repeated. Many people bring their children to a clinic that my child spends more time with mobile phone than with textbooks, or he is not studying well. Reason being that studies don't give him pleasure, whereas mobile gives him pleasure, a game gives him pleasure, an activity gives him pleasure. He repeats that activity that gives pleasure. Most of us indulge in I don't call it antisocial, but which are not very social. Watching a porn. Why we do that? Because it gives me instantaneous pleasure. We continue to do an activity if it gives a pleasure. We don't even shun away from a bad activity because it doesn't result in immediate punishment. We indulge in a lot of activities which are not good because there is no punishment immediately. Something like, let us say, alcohol drink. People, in spite of repeatedly saying that alcohol is injurious to health, we continue to drink because there is no immediate hepatic insufficiency happens after a peg. It happens few years later. Same is the case with smoking. Lung cancer doesn't happen after a puff. It happens after many, many years. That's why, in spite of your repeated telling, they don't do that. So, friends, any activity associated with pleasure gets repeated. Any activity that associated with immediate punishment will not be done. Something like you don't fall from height deliberately because immediately your legs are broken. If they are broken after 2-3 years, everybody would be jumping from 100 feet. So this is the problem. So this is the understanding of psychology that if it applies in our day-to-day practice by physicians, I think better health can be achieved. As I said, I will not bore you for a very long time. I once again thank you for giving me this great opportunity of talking to you. And once again, I apologize for the technical glitches, which both I can't say that it is beyond my control, but they did happen. I apologize for that. And once again, I apologize for not being there physically with you all, which I wish I would have loved. I'm looking for such an opportunity in future. Once again, I thank you all and wish this conference a grand success. Thank you very much.
Oh, thank you, Dr. N. Raju sir. Even if you are not here, your mere presence on the screen is actually a blessing of yours. In a sense, whatever you have said, I will give example. In a depressed person, it takes at least 2 to 3 weeks to show recovery. I mean, we talked about the neuroplasticity. So neuroplasticity definitely is at cellular or molecular level, which in my opinion is physical. And whatever changes occur that finally result bringing that depressed person to euthymia. So this is the best example of what is called as, intricate relationship between mind and body. So with this, we'll move on to the next issue, that is inaugural function. So inauguration will be done by lamp lighting. So I request Vaishali ma'am to call the dignitaries for lamp lighting.